Sure. Hi, I'm Cindy Gay. I am an infectious disease physician at the University of North Carolina. I see patients, and in the outpatient setting and clinic, mostly patients with HIV. I also do clinical research and primarily with a larger group that includes a lot of basic scientists who are trying to answer um, new questions about, in particular, how we get closer to an HIV cure. And my role within that is really any sort of patient or participant-facing studies that can include anything from collecting samples, such as blood, that help the scientists be able to do their studies in the lab, to when we have a new and exciting idea, um, developing and enrolling a study, and thus the participants.
Wonderful. Thank you so much for joining us. So, Dr. Gay, how did you get started in HIV research? What made you interested in even exploring this as a topic?
Well, it has a lot to do with my age. So when I was finishing up medical school and then entering into residency, that was the late 90s, early 2000s. And at that time, it was really just devastating. We were just starting to have what we would consider effective, easier to take treatment for HIV. And I was really interested in global health, so I had some experiences during med school and residency where I went to Africa and was working in clinics and in the hospitals. And at that time, there was no country in Africa that had any ART program where they were providing treatment. And that was it. It's like, if you, for me to have a career where I could do the most good, it was just such a huge problem that it felt like that was the thing that I really needed to focus on. And I do love infectious diseases because, one, you have to think about the whole body. It's not just one organ. And you have to think about the person. You have to think about where do they live? What do they do? Um, what are they at risk for, and how are you going to help them treat whatever infection they have effectively? And the other nice thing is a lot of times you can cure people of an infection. Unfortunately, HIV is not one of those yet.
Well, I think that's a really important statement that you just said that we can't cure it yet. But I think one of the amazing and interesting things about you is that you are working on HIV cure research. So, what is it, and today is Women and Girls HIV Awareness Day. What is the work that you're doing specifically related to women and trying to find a cure for HIV?
Yeah, I will say my role is just to support other people, really. I think we've learned in research, and particularly in cure research, that you have to be intentional in trying to enroll the population of interest. That's kind of a very researchy way to say something, but in the United States, in the vast majority of clinics, we will have a majority of the patients in said clinic will be more men than women. And for example, in our clinic, that's about 75% women to 25% women. So when we're enrolling on a study where we want to enroll both men and women, it tends to be heavily weighted towards enrollment of men just because what the denominator is. But there are other challenges. But that creates uh, I don't want to say a problem, but it creates a challenge that we can't ignore. And so it has been for many years of an answering to other voices in the community saying we need to do a better job. And they're right, because more than half of the people living with HIV in the United States are women. They're not 75% men and women, they're more women. Um, the vast majority of them live outside of the United States, but when we're trying to get to a cure, we want a cure that's going to work for everyone. So,
Absolutely.
yeah, within our group at UNC, Nancy Archin, who is a basic scientist, has really championed this, and she has some dedicated studies where she's trying to answer some really basic questions about, are there differences between men and women, and how, I'm going to pull out a researchy word, the latent reservoir where the HIV virus hides within our cells. Are there differences in men and women and how much there is? Are there differences in where those cells are kind of hiding out in the body? And she's even been doing a recent study looking at the effects of estrogen on this issue. So if you're a woman, you know that hormones do impact a lot of things, including our bodily functions. That's what it's designed to do. So she's made, a real decision to focus on these questions. She's within a group that's it's a committee called the Women at Risk group within the International AIDS Society. They're all women. They cross different sort of expertise from basic scientists to sort of sociologists to behavioralists to think about all these issues that are relevant, sometimes specific to women, to why are they at risk for HIV? What are the challenges to them getting treatment? What are the challenges to them in trying to prevent transmission to their children? I could go on and on. But I'm really proud of Nancy and this work that she's doing in collaboration with other basic scientists outside of UNC. That's one of the really great things lately has been the establishment of groups, and there are several across the United States. UNC is sort of a home for one, where you're bringing in expertise within UNC, but also outside of UNC to get these really great minds together to really move things closer and faster and work together. So Nancy's I'm cheerleading her today because she's really taken that up and been really successful.
I want to also, I think we oftentimes focus on, and rightfully so, we focus on women and girls who have HIV or who are impacted by HIV, but it's equally important for us to lift up the female scientists because you all are asking those questions that need to be asked and answered on behalf of women. And oftentimes, because you are women, you're thinking about it in a different way than if it were just mostly men in the sciences. So I just want to also lift you all up and, just kind of thank you for even asking those questions and really being a champion for helping answer them. One of the things that I think about is, the work that was done to see the differences between men and women in regards to PrEP and how we learned that the medicine actually reached kind of the rectal area of men in a quicker time span than it did the vaginal tissue of women. And so that was something that was really important for us to know because if women were to take PrEP, that they needed to take it for at least 30 days to be protected. If women, excuse me, if women didn't participate in research, we wouldn't have known that. And they would have taken the medicine and maybe not have been fully protected. So I think it's really important for us to know that, have those types of questions and have them answered by having women who are scientists who are asking the questions as well as women who are participating so that we can better serve and better treat women.
I totally agree. It's not only women who are doing it, but a lot of these efforts are either started, championed by, and sometimes, it takes a while to have your voice heard and get a study funded, for example. And the community has played a large role in this, and sort of asking for and sometimes, strongly encouraging us to focus on these issues for women. And it's a good ask because I would say oftentimes to be able to enrich and, allow more women to participate in studies and or get the studies funded, it takes, time and energy and sometimes perseverance. And if there's one thing that I know women are good at, it's perseverance. Um, yeah, I appreciate you saying that. And I just, am grateful that enough women have, persisted in being heard.
So I want to share this slide that you sent me. Let's see if I can get it up on the screen for us. Because it really highlights what we're talking about. So can you walk us through this slide?
Sure. This is a slide from the World Health Organization, and it's really kind of breaking down, and this is showing data from 2019. So the numbers would be a little bit higher, but the basic idea is the same. So if you look to the far left column, it's people living with HIV in 2019. And the middle column is people newly infected, so new diagnoses. And then on the far right, HIV-related deaths in the same year. And then, starting at the top row, you have the total. So it's all everyone, adults, children, men and women. So 38 million. You keep going down and then it's just adults. So that's 36.2 million, excuse me. And then you get to the next row, which is just women. So 19.2 million of the 36.2 million are women. It's over half. So for example, in my field where we're doing cure-related research, we can have studies that are these sort of intensive, phase 1, phase 2 studies. And if we only enroll men in those, early phase studies, boy, it seems disproportionate, right? And we really, really need to and want to do better. And so, again, 19.2 women, I really can't get it out, 19.2 million women versus 17.0 million men. So it just, I think, is highlighting that point. And if you look at there are slightly more new infections in men and in women, but that is not the case in Africa, where the largest number of people with HIV live. In Africa, I think from the ages of, I maybe get it wrong, to 15 to 24, I believe, and that sort of young, adolescent young women are 3 times more likely to be newly infected than men of that same age group.
Oh, wow.
Right, right. So the idea you mentioned about coming up with ideas for preventing infection in women, treating them, and then really wouldn't we love to be able to get a cure, but that cure needs to work for men and women. And even if it's the same cure, rolling it out and making it accessible is as we know, with treatment and PrEP, and many other things, is not always the same. So we need to be thinking about that now, as even though we're in early stages of, the basic science and early studies trying to get us closer, we really need to keep this vision and these numbers, as boring sometimes as they are, but they tell a story and it's meaningful.
Thank you. So have you seen any differences so far? Have you found any, or do you know, I know you're not quite doing, it's Nancy who's doing the research, but do you know of any findings yet that have come out of the work that have seen any differences between men and women?
Yeah, it is sort of early work, so smaller studies, but I would say there were some earlier studies that were suggesting, for example, that there might be differences in where the latent virus is hiding out in cells, that estrogen might impact that. And so far, I think it's fair to say, most of Nancy's work has suggested that there aren't really some of the differences that were hypothesized. But that's meaningful to know, right? Sometimes having a negative result is important and informative. Yeah, I think that's the sum, but there's a lot of work that's ongoing with that, and another study that's sort of also looking at that idea of estrogen and using a medication that affects estrogen levels, that's being conducted in the AIDS clinical trials group. So just uh, a group that oversees studies that can be implemented across different sites to get an answer faster. So I think there's a lot more to come on that.
So, if estrogen levels might be an issue, are you doing research on with women who are of reproductive age, or are you mostly doing research with women who are in menopause, and why?
So the study that I know about that Nancy's involved with is mostly looking at women with menopause. And some of her other studies, she's really looking at women across the age spectrum. So, they would be a different premenopausal of child rearing age, for example. So I would say she's not narrowing in that. There are different studies that are answering different questions.
Okay.
Um,
And what about trans women? Are there any differences there?
For the trans women, I don't know of any studies that have specifically looked at the question of estrogen or latency in trans women. I do know that the AIDS clinical trials group it's open actually. We've just opened a study recently it's not really cure related, but to look at whether feminizing hormone therapy that individuals decide to take, whether that affects their levels of antiretroviral therapy. And that is sort of an unanswered question, and it is really important. I think it's overdue, but I am grateful that the group is focusing and answering some questions for that particular group.
So
Go ahead.
I was just wondering if there were any thoughts that you had on how women could be more involved, not just in participation, but in general, how women can be more involved in the research process.
Well, they're all different types of research. So I would say you don't have to be in an early new phase clinical trial to be contributing to answering questions. So the sort of example I give is sometimes both to people in training, but also my patients that I see in clinic. Sometimes I say it might be a survey where sometimes we're just trying to answer questions about how to do something better in clinic, or are we doing a job of this for our patients in clinic? Sometimes it's questions on, what is about individuals' life that may and in some way affect how they either access treatment or just how they feel about it even. So, saying yes to, answering surveys or doing those kinds of um, studies where you're not necessarily taking a new drug, those are meaningful things to do and, less risky and maybe a nice way to sort of try out being on a study and getting a sense for whether you like that experience or not. And sometimes I think it's just helpful to get to meet the people who do it because we don't really seem like people in a lab with a white coat on, sort of the contrary to that, just, regular folks who want to be helpful. Um, I think there are also certainly a lot of community groups that in some way um, focus or support people with HIV. And it's not always that's their main focus, but that's incredibly helpful. I think it's a place to sometimes learn about research. They sometimes tend to know about it. A lot of those folks, there's sort of a lot cross-pollination between community and research and clinics, and there's a relatively tight-knit group. So that's another good place just to sort of get a sense for what's going on within the community around HIV. It's can vary a little bit from one place to another, and getting a sense for who are the people involved, um, and in your local setting.
Awesome. And then one last question I have is about um, there are two women that I know of who have been declared cured, but not from a therapeutic intervention. They were declared cured because their body has been able to naturally control the virus and not progress into AIDS, right? So could you explain a little bit about that and what you know about those women?
Gosh, I have not actually read an update on them in a bit, but what I can say is, if focusing on the women, there was at least one woman who did have, I think, a stem cell transplant. It was a slightly different type of stem cell transplant than what had been reported for the men, and was a little bit exciting in that sense. So a cure through a treatment not specific to having HIV, but to having a type of cancer. So it basically is nice because it tells us it's achievable. We would never want someone with HIV without cancer to go through that because it's a very risky, hard treatment. But of course, you would do it if the option was, to die of said cancer. And then there's a woman who, if I remember correctly, I think had been on treatment for some time and then stopped. And we do know that there are other individuals who aren't in treatment and sometimes participate in a study and then stop their HIV treatment and seem to control the virus for quite some time and what we would not expect. So something has changed in the way that their immune system can control the HIV virus. We don't really understand what that difference is. There are examples of other viruses, many, in fact, that we get infected with oftentimes when we're younger, but that don't give us any, and stay in the body, but don't give us any trouble or any symptoms because our immune system essentially keeps them in check, keeps them at bay. Sometimes as we get older, or if we have to be immunosuppressed or take treatment that suppresses our immune system, they can kind of wake up and be an issue. But it's an example of how our immune system is really an amazing thing and can certainly control other viruses. So why the HIV virus has to be so difficult and challenging is really a great question, but I would say that these examples that you mentioned give us, again, a sense of real hope that there might be things that we can do through a combination of treatment and sort of immune enhancing strategies is the all-encompassing word we use. And a lot of these different approaches that we and other groups are trying out, that we might be able to sort of get our immune system to a place where it could control the virus without having to take, treatment every day or injections every 2 months, which is kind of the newest, and just give people a sense of relief, I think, from that being such a part of their daily life and some of the baggage that unfortunately comes along with it
Right.
for some.
How appropriate that you said it gives us hope, because one of the women was named the Esperanza patient, which is hope in Spanish. So I really appreciate you taking the time to answer these questions for us. And if anybody who wants to know more about Dr. Cindy Gay, you can find her how? How do we find you, Dr. Gay?
I think you can Google me and find me on the UNC, but Cindy Gay UNC would take you to, I think, a few pages where you could find me.
Thank you so much.
Yeah, thank you. I wish everyone well.